Well, good morning to the NeoMed community. I hope you all had a safe and enjoyable weekend. It's my pleasure to be able to bring you a brief update on the university changes that have taken place over the course of the last week, mostly intending to give you an update on the budget restrictions that have come our way, the return to work presence here on campus, and a little bit about the strategic planning process. I'll start with return to work. I just had a discussion with Dr. Steve Schmidt, who is our Dean of the College of Graduate Studies and our VP for Research. He's spent time across campus observing what's taken place since we've returned a small portion of our community to work last week, and noted that everybody was following the precautions for keeping each other safe, observing social distancing, hand washing, and utilization of masks while on campus. So thank you all very much for that. It's really critical that we continue to follow this so that we can keep each other safe and keep each other healthy. I am not planning at this time on expanding our footprint on campus until likely June 1st. And again, that's going to be based upon science, and that's going to be based upon our state and what we see take place with the governor's office and our Department of Health. It's important that we go a little bit slowly. I know we have a great deal of number of individuals who live with people who are at risk or may be at risk themselves. Our survey indicated that could be as high as about 40% of our population. So we are staying restricted to our operations personnel, our police force, and our researchers who individually identify themselves as needing to perform critical research. Last week, we limited each researcher to one member of their team that could be present on campus. Because of how well the rules have been followed and the fact that we've had no congregation taking place, we are going to increase that capability to 3, as long as all the rules on social distancing, masking, and hand washing are followed. But that is going to be restricted to research personnel, and we'll continue to have our operations team present, some members of our executive management team present, and our police force. For the rest of our community, we're going to continue to hold off until likely June 1st, perhaps later. It just depends on what we see take place across the state and across the nation over the course of this month. I would say if you have any questions, please make sure that you reach out to my office or to your supervisor, preferably, in getting an understanding of what impact this has on you specifically. But most of you should know who you are and what impact this has. If you've been present at work for the past 1 to 2 weeks, you'll continue to do so under the discretion of the supervisor that you report to. Anything new is simply going to be around researchers who have self-identified as performing critical research operations that must take place on campus. I'll note that critical research has been allowed by the governor's office. Actually, since the COVID-19 restrictions have been put in place, we have been more stringent about that on campus and are now just doing a careful opening of that are still in line with the governor's rules that were set forth approximately 6 to 8 weeks ago. The next piece that I really wanted to spend more time with is an update on what we discussed last week. And that is the budget restrictions that are taking place from the state and having pretty dramatic impact on universities across the entire state of Ohio. As I noted last time, more and more universities are coming out with their plans for the future, and every one of them has noted they're planning significant layoffs, furloughs, budget cuts in other non-personnel areas, as well as planned salary reductions for those who do remain employed on their campuses. This is something we're also seeing across the state outside of the university systems, as we're looking at private industry with a skyrocketing unemployment rate due to these same needs and concerns, as well as health systems that have been operating throughout the COVID-19 period to take care of our community, where there have been reductions in salaries up to 20 or 30% across the board at those institutions. spent a great deal of time with our budget team and members of the executive management team responsible for our various colleges and various divisions across the university. We still feel fairly strongly that we're going to be keeping people employed across the university here at Neomed. But as I noted before, in order to do that, we're having to reduce the amount of dollars being expended on certain areas. And that means in order to keep everyone employed, we're going to need to be able to share in some reductions on benefits across the university. The dollars have to come from somewhere, and I would prefer to have them impact all of us slightly rather than to have members of our community who are all essential lose their positions at the university either permanently or temporarily. I know there was a lot of concern about that. One of the examples I brought up on benefit reductions was that there may be a big impact on the university's policy of reimbursing tuition for local area for our employees. We know that that is going to have to take some type of a reduction in order to keep our team employed. It will not be across the board, at least as currently planned. And my intent is that any reductions put in place would be either minimal or not affect at all those employees who are under the $75,000 a year salary range for the university. Anything above that would be scaled up to a particular level and then eliminated beyond that. So please know we are trying to be fair in looking out for our team members, understanding that these impacts are greater for those individuals who are earning less dollars at the university. And we are here to support you, and we are thinking about you very carefully and the impact that this can have on you. All members of the executive management team have brought this up, their concerns and best ways that we can deal with it. And so we are not just doing this without doing this in a very thoughtful manner so that we can ensure that we have as little impact as possible on the critical members of our community. There are areas where we can make cuts that are going to be non-personnel associated that will not have dramatic impact on the majority of our campus. These include continuing with the state's requirement for a freeze in hiring, as well as an elimination of travel at the university. Most universities have put this in effect for all of fiscal year 21. That starts July 1st of this year and carries through June 30th of next year. Now, across the board cuts without being thoughtful often hurt the university. So our intent is that travel will be reduced to about 30% of its current level. And there are other areas where we're doing similar reductions. So they're not going to have really any significant impact on our personnel. It's really going to be more aimed at reductions that have already been imposed on us because of COVID-19. We're doing so much now through this format that you're looking at via Zoom, which means we can eliminate travel, we can eliminate expenses around meetings, we can eliminate expenses around events because events have been canceled uniformly across the state and across the nation. And so these dollars are absolutely critical for us to be able to reserve. What we saw from the state government on Friday through the governor's reductions that were discussed in his Thursday briefing was that the university took a $900,000, approximately $900,000 reduction in state funding for the last 2 months of this year. Now, we are living in a time of great uncertainty, and the state legislature and the state governor's office will be working together to find solutions that ensure we balance the budget as required by the state constitution. So as they do that, we are looking at cuts taking place for next year. And the current expectations is that we will see the same level of cuts applied broadly across the entire year next year. So whether that's 900,000 over a quarter or 900,000 over 2 months, we need to multiply that anywhere between 4 to 5 as a minimum to understand how it's going to affect the university next year. Our expectation is that we'll take about a $4.5 million reduction in state funding. And this is why our budget is planning for this. If we find that we are in a position that those dollars are not reduced as much as we thought they would be, then we will reassess by November or December if we have that information available from the state at that time, and figure out how we can undo some of the restrictions that we put in place, some of the changes that were required, in order to ensure we're taking care of the outstanding faculty and staff who help us run this organization day to day and deliver on our mission of research, education, and service. So please, we take your input very seriously. We are looking out for you and the great work that you do for us in helping us to continue the mission of this university. And please understand that we are doing this with a strong understanding of the impact that it has on individual members of our organization. We are here for you. We are here to make this have as minimal impact as is possible. And it is going to impact us. We know that. It's impacted us already to date, but we've been able to stand up and still deliver a good product. The area I think that has been most greatly impacted really has been our research, because our researchers are not, have not been present in the laboratories in order to continue their work, to seek federal and state and philanthropic funding to continue the research efforts that they are performing that are driving advances and changes in our understanding in healthcare, healthcare delivery, and the life sciences. So that was our initial impact on bringing people back to campus more broadly. And for the long term, I really see that the financial impacts are really going to have the greatest impact on that portion of our mission. So we're doing everything we can to limit the effects of that. And finally, I wanted to give you an update and thank you. We are trying to better understand where we should be going forward as a university through smart growth. Limiting the amount of dollars that we spend as a requirement because of budget cuts is absolutely critical for us to survive. But at the same time, we don't want to end up in the spiral of doom where we're continuing to cut and deliver less. We need to think smartly about how we move forward and use the limited resources that we have available to grow programs that are going to add to the university's bottom line and support our mission of research, education, and service, and at the same time offer incredible value to the community that these programs are developed for. So if we develop new educational programs, the key is they must offer tremendous value to our students who take them for adding to their livelihood as they leave the university. And at the same time, they need to be able to be not just self-sustaining, but they should contribute to the overall university picture on how we sit financially and allow us to continue to grow smartly with programs that make sense. This means understanding our strategic plan going forward. How do we set a goal for what our vision should be, and how do we go about achieving that goal? The key here is that we need to ensure the entire community is involved in this process because we are all affected by it. We talk about shared governance, and shared governance means everybody having a say in how we move forward and how we operate as an institution. Shared governance can be very difficult to put into place. As I've mentioned before, it's hard to get all of us in one room and have a discussion where we make a decision on many, many facets of this organization to move forward. So instead, part of what we do is rely on our hierarchy at the university, department chairs, college deans, vice presidents, program directors, so that they take your thoughts and your ideas and then bring them up to us to be able to ensure that we incorporate into our plan moving forward. A really useful way for us to do this is through surveys. These are not surveys that are meant to capture data that is simply put into a box, so that the efforts that we used to do this, our time and our efforts to actually answer these, are not utilized to make sense for this university. The intent is that we will take all of this information and look at what you've had to tell us and to share and best understand where we should be going forward. So please, thank you. First of all, thank you for all of you who've completed the surveys that have been going out around our strategic plan. We've had really outstanding participation. The first one, over 300 people answered. The second one, we were down to about 200. We do have a total of 7 of these, and we need to get these completed within a 2-week period of time so that we can move forward pretty rapidly around how we go forward as an organization. So please take the time to fill these out. We are utilizing this information that you're providing as really a guiding light for us to understand where we need to go forward as we work with our board of trustees to set a strategic plan for this university that we then operationalize and tie to our budget so that we can set ourselves apart and continue to differentiate ourselves as a university that our students want to attend, our faculty want to stay at, new recruits come to because they see outstanding value and outstanding potential to be part of something much, much bigger, a growing organization that's having big impacts both regionally and setting a benchmark nationally. Those are the three topics I wanted to update you on and to share the information that we currently have available. Understand that the only certainty we have is that we have uncertainty, and that uncertainty is around where the state will go with funding. That uncertainty includes where we will be come August and September when we expect our fall semester to be in session. It's going to depend on what the current virus situation looks like nationally. Are we experiencing a resurgence, potentially a greater surge than we've experienced in the past? Have we flattened the curve and now we are seeing low levels only with new therapies on the horizon? We just don't know. So we're trying to lead during this period of uncertainty in a way that keeps us both able to pivot in a way that's necessary to maintain our success, and at the same time ensure that we have the dollars available to fund our mission and to move forward as an organization. So with that, I'd like to open it up to questions from our community.
Yes, with budget cuts and hiring freezes, the current hirings that are going on right now, how are those justified? And new positions of high dollar amounts, how are those justified?
So the current positions that were identified as critical and are being filled actively, we're actually nearly done with the recruiting process on the majority of those, are positions that we have to have as an organization to survive. For instance, all of you have heard a lot about the Liaison Committee for Medical Education, or LCME. When they came through and gave us our findings in late November, what they told us are there are things you absolutely have to have in place and change in this organization to maintain yourself as a sustainable enterprise that we will continue to accredit. And without their accreditation, we are not able to operate a medical school. So those positions will continue to be filled. They've been deemed to be absolutely critical to the long-term survival of Neomed, and we are filling those. We are nearly finished with the process, and we will bring them on board. We looked at currently unfilled positions that have been open at this university, many of them for years, and we feel we can have a very substantial impact on freezing those. Now, the governor has asked us to freeze in general across all hires. We can make the decision that in order to survive as an organization, that some of these have to happen, and we have justification for that. And that's really what we've done. The key for me is to not bring in individuals for open positions that are unnecessary. Part of that is a better understanding of who we are as an organization if changes have occurred. The LCME has asked us to modify our teaching programs in the medical school. That change that many of you have been heavily involved in has resulted in a dramatic change in the way healthcare education is being delivered at this institution, and in line with where cutting-edge institutions have already made these changes. They result in a reduction in some of the positions that we've had in the past for teaching. So I don't want to look at promises that were made by past administrations on hiring additional faculty members to meet the teaching workload when we're finding we don't actually need those positions now, or director positions for some of the ancillary and support services across this university when we find we're operating more efficiently now and do not need those to be hired. So we've been very judicious about this, and the positions that are being filled are considered critical for us to survive as an organization.
Next question on the budget. Can we use last year's reserves or reserves in the past to help with the budget cut?
And we have used reserves. Now, we do need to maintain reserves within state required levels as an organization. Otherwise, the state comes at us and says that you are not being fiscally responsible and you put yourself in a position of jeopardy. And we're not allowed to go there with that, because if we do, then we undergo more scrutiny and more sanctions by the state. And this is why you're seeing such dramatic changes take place across all of the other universities in the state of Ohio. And very likely other universities across this entire nation. We expect that many universities, especially private organizations, aren't going to survive this economic downturn that's occurred around COVID. So we will judiciously use our reserves, and we have done so already to date. Some of the reserves were swept by President Gershon last year in order to help meet the operating demands of this university and some plans for growth. I would like to limit touching our reserves as much as possible, but we will do it in the short term as necessary. Now, we can't do this for the long term. If state cuts, as they often do, become long term, and these cuts are in place for the next 5 or 10 years or more, we can't continue to whittle away at our reserves to operate business as usual as we have in the past, because those reserves will become depleted. And as they do, we become at huge risk of not being able to exist as an organization, because we don't have the reserves that are intended to weather storms that are temporary, not long-term depletions in our operating dollars.
For those who make more than $75,000, will there be some educational benefits for the fall of 2020?
Our hope is that they will. I'm waiting for Mr. Burton to get with me today. In fact, he was tasked with putting together several scenarios for us to be able to reduce our expenditures. I noted last time that currently we spend $500,000 a year on this benefit. And it's a benefit that's gone away at most institutions. What I'd like to do is be able to preserve somewhere between half and 2/3 of those dollars, because I do understand that it's a critical benefit for many of our workers, especially those who are in pay ranges that are going to be less than $100,000, but certainly less than $75,000 per year. So I would like to put in a block period where those at lower levels of income aren't impacted at all. And those who are in moderate ranges will take a reduction, but not a complete elimination. And then, of course, we'll hit a threshold level where there will be a complete elimination. I think it's just easier to do for people who are in the higher paid ranges, that they're going to be able to eliminate this so that we can help those individuals who would have a bigger overall impact on their financial status if we were to eliminate this directly at those levels.
If salary cuts or increases towards insurance premiums are enacted, will there be a percentage across the board for everyone, including full-time faculty and executive leadership positions? Or will it be done in a way to consider those that are at the lower end of the salary spectrum? They feel these cuts far deeper than those at the top.
Yeah, so we're being very careful to ensure that it's being applied in a way that it has far less, if at all, any impact on those who are in the lower pay ranges. For instance, I've already had the human resources team start to look at what these could look like. And they gave me one scenario that was a broad, and I asked for this, was a broad cut for everybody, and 3 scenarios where it was a graded cut, either elimination at the highest levels and no elimination at all at the lower levels, to elimination at the highest levels or having to pay substantially more at the highest levels, and some smaller cuts at the lower levels. And those are the scenarios we're looking at. I really don't think there's going to be a huge amount of impact felt on those who are in the lower 1/3 of our pay tiers.
Are there any updates regarding PPE availability for employees who would like to be on campus on June 1st and beyond?
No, we don't have any updates necessarily right now. We have asked to have PPE brought in for our researchers who are required to wear medical grade PPE for some of the research that they conduct. For the rest of us, we're asking you to utilize the same PPE that you're utilizing now as mandated by the state to go into many of the businesses that you go into. So home use creation of masks. In fact, I've been wearing a homemade mask that my daughters helped put together for me when I'm outside of an office setting that has been made from articles of clothing that were discarded in the home. So these are the things we're asking you to wear. And remember, that PPE is being mandated on campus, and it's not your protection necessarily, it's everybody else's. So they're wearing theirs for you, and you are wearing yours for them. Surgical masks that we wear in the clinical setting work the same way. It's not about protecting the person wearing the mask, it's about the individuals around them. The only deviation from that is the N95s, which are still in relatively short supply. So N95 masks do protect you as well as the people near you, whereas surgical grade masks, as well as the masks that we're making for home use, are really about protecting others. So when somebody is not wearing it and they're feeling like, I don't need to wear this, I'm going to do just fine if I get COVID-19, you need to let them know and to alert the authorities here on campus if you see it. It's not about them, it's about you. It's about protecting you when somebody else wears their mask, and it's about you protecting them when you wear your masks. So that is the only PPE you're required to have here on our campus. It's mandatory, is use of a mask, and it doesn't need to be a medical grade mask. It's been shown that homemade masks will work just fine. We are supplying hand gels, but for sanitizing your hands. We are also asking you to soap and water, which is actually more effective for things like viruses and bacteria. There are a few types of spore-forming organisms that hand washing is absolutely better for, and many of the gel substances that we use doesn't work on. So hand washing, 20 seconds, is still the best solution for you out there. We are also doing deep cleanings as required by the state and per recommendation of the CDC. These are being done by our operations team. And then social distancing, staying 6 feet from one another. If you follow all of these, many have come out in scientific research showing it's likely just as effective as a herd immunity, where 95% of the people are immune to the virus, giving everybody protection and reducing the cases dramatically, that if we all enact these same measures, we will do roughly the same thing.
Will vaccines for flu and or COVID ever be made mandatory for staff and faculty? If yes, what accommodations will be made for those who prefer not to be vaccinated?
Yeah, so if you work for most healthcare organizations, they already mandate that you have the flu vaccine. And in fact, we should likely be doing the same thing here, and it's something we will look at. Many of the healthcare facilities that mandate this state that if you have a valid reason why you can't be vaccinated, that during flu season, that you must wear a medical grade mask at all times. We will look at what we need to do around this. Currently, there are no COVID-19 vaccines available. And when one becomes available, I would expect that it won't be a NeoMed requirement. I'm expecting this to be a federal and state requirement for vaccination.
For incoming students, should we message to them at this point that the delivery method of fall coursework is still to be determined, or will it be a mix of virtual or in-person experiences?
Yes, it's to be determined, but we've had a number of discussions about this. Our expectation is that it's going to be a mixture. Medical degreed individuals, so those who on our campus become physicians and pharmacists, require critical laboratory training, gross anatomy laboratory, histology laboratory, compounding laboratory, amongst those. Those need to take place on the campus, and I don't see how at least some footprint of those still taking place can be eliminated and still provide students the quality education they need for us to be able to graduate them to the next level in their early years. And being present on campus, meaning in the clinical settings, the hospital settings, the family doctor's office settings, is going to be required for our third years and to some extent our fourth years. So it will take place. How we eliminate the footprint from in-class lectures, which has been typical at universities and the medical school, and using virtual with Zoom, that can still take place the way we've been doing it if we're required to do so. The other is we've already been mapping out our lecture halls. How do we maintain 6-foot social distancing? How do we ensure that there's adequate mask availability and hand washing availability so that students can be on campus when they absolutely need to be? Dale Luch with our operations team has already mapped out our campus. I came back, now these numbers are going to be close. I believe the Watuna-Unicorn Auditorium can normally seat around 360. His analysis, I was told this morning, came back that we could have about 65 students in that space and maintain appropriate 6-foot distancing. So we may have to utilize classrooms differently, but still bring members on campus for critical hands-on experiences that just can't be replaced with Zoom. Now we may be in a position where we have to go to the state and ask for a waiver to do this. We just don't know what the state is going to mandate, and they don't either for next fall. Because we really don't know what's going to happen. Is there going to be a second surge? Is it going to be worse? Is it going to be lower? I think it's important for all of us to remember that what we're doing with these social distancing and masking precautions is not eliminating your chance of getting the virus. We're eliminating or greatly reducing the risk that we won't be able to provide healthcare because of a surge in our hospitals and our ICUs. And we've done that very, very effectively. So if you do return to work at some point, does that mean you're coming to work with any risk eliminated for COVID-19? No, we can't do that. And it's the same thing we can't do with you going to the grocery store, to the pharmacy, to any type of outside of your home facility, or eliminating it in your home if you have multiple members living there who have to go out into the community, as we all do. We're just trying to ensure that we can keep the mortality rate and the significant morbidity rate of this disease as low as possible, and that we're not overwhelming our health systems. I think it's important that we don't forget that. The predictions were that 40%, at least the early predictions were about 40% of us will all eventually get exposed to COVID-19. It would be ideal if that doesn't happen until we have a good therapy available, or we have a vaccine in place, in which case the exposures would have much lower impact to us or maybe no impact on us at all. But it's not clear we're going to have a vaccine or that we're going to have a really powerful therapy for it ever or in the short term. You remember HIV is a virus, and it's been around since the late 1970s. There is no vaccine for it. And it took us a decade or more before we started having really good therapies for it. It would be ideal if we do. We just don't know that we're going to have something. And certainly we're not all going to continue to shelter in place for the next 5 to 10 years. So there's going to be some risk, we assume, with everything we do in life, and all of us are going to have to make those decisions.
There's a position down in IT that occurred just before COVID hit. It was posted and then removed. Will this position be able to be reposted? The position is vital for financial aid, accounting, registrar, human resources team, support to move forward. This seems critical. Can you speak to it?
Yeah, I don't know which position you're referring to. I will talk to our HR team and try and understand better what position you're referring to. If there is a position at this university that does not allow us to fulfill our mission requirements, then clearly that's going to be a critical hire, and we will do it. There are positions here that have changed dramatically over time, and we have some that have been listed for, at least they've been on our books for over 1 to 2 years. And those positions clearly are not critical. Otherwise, if they were truly critical, we wouldn't have been functioning as a university over this period of time. So those are the ones we're really looking at eliminating in the short term. And of course, we have to be very careful about positions that we do fill, because as we do so, one, will be scrutinized by the state, as our governor has put a hiring freeze on state institutions. And two, every person we bring on it leads to us spending our money across a broader platform of people. Right? We have If you have a fixed pool of money, which has been reduced, and we bring in something new, then those dollars have to come from somewhere. If there were a number of those dollars mean that we may get in a position of having to do furloughs, bigger cuts on benefits. And I really don't want to do that. I want to look after the team members we have here now. So we will look at any open positions very carefully. We'll scrutinize them to understand what impact they have on the university not being filled and what impact they have on all of us as an organization if they are filled.
If there are grant-funded part-time positions that have not been filled, are those affected the same way?
No. So grant funding is outside of the dollars I'm referring to. We have many researchers here at this organization who have grants, federal grants, philanthropic and state grants, and they often include dollars that pay the salaries and benefits of the employees under those grants. Those are not the dollars we're talking about. As long as those dollars are still here and still present, we either spend them for their purposes or we have to give that money back. So those will not be impacted.
Budget cuts, will they be inclusive of all areas or just academic areas or also non-academic?
No, they're being inclusive of all areas. I have very carefully gone through and identified where the majority of our cuts can come from that are really programs that are not going to affect the whole university or specific areas that you're referring to. However, in addition to that, what I've asked all managers to do across the university is to figure out how to do at a minimum 5% cut in operating expenses for non-personnel costs, non-personnel costs. So that means things like paper, copying. It could be events that we hold. During times we're operating well, as we were about 6-7 months ago, we often have events to recognize members of our community. These could be food, it could be drinks. It's an opportunity to get together where we use conference services. And these cost the university dollars. In fact, we spend close to $750,000 a year on things like this. So in order to keep our members employed and doing our work, it just means we're going to have to reduce things like this. For instance, one of those things that traditionally is done at a university is the inauguration of a president. Now, that inauguration is usually meant to be a community event. It's there for the university to rally around a new leader that they're going to work with and support. We delayed ours, and honestly, as I looked at it in careful detail, I've decided to eliminate that event. That event would probably run us somewhere between $20,000 and $30,000 to do if we do it the way other universities have. And I just think that cannot, in good conscience, even if it's meant to be a rallying and team building event for the university, we can't do things like that. So for those of you who may have looked forward to it, I'm sorry, but I have made the decision to eliminate the president's inauguration, which traditionally occurs within 6 months to a year of starting. I see it as a formality. I'm already with you. I'm already doing the work. And honestly, it's a pomp and circumstance that I feel no need for. And if we can save the dollars to spend wisely at this university, that's what we're going to do with it. And we need to look at all types of events at this university that are similar to that and say, can we eliminate these? It's great to be able to get our people together, to rally around an event that recognizes members of our community. But cutting those, at least in the short term, while we figure out our financial situation, is an easy thing for me to do when it means that I can keep you employed and I can keep this institution running well and delivering upon our critical mission.
What, if any, changes or cuts should students expect for travel expenditures, conferences, presentations, etc.?
Now, right now, we have cut all travel at the university per the governor's order, which has eliminated both international and then any state travel across the board. And this is what's being done at all universities. So for now, unless it was something that specifically came out of a student fee, those are being eliminated. It doesn't mean that dollars in a grant will be eliminated. If you're a student operating under a faculty member's grant, and that a grant allows for travel for presentation at meetings, that will still take place. Those are outside dollars. But otherwise, we have eliminated travel across the university for these other types of events. And I think it's really going to be not a big impact item for us, because to the best of my knowledge, there are no meetings that are taking place in person through October. And I've been told most are actually going to wait until next year. This includes major meetings that we normally present at, both medical and scientific meetings. That's not to say medical meetings aren't scientific, but there's some that are clinically focused and some are basic science focused. Those are taking place by Zoom, and they're very effective, and they eliminate the costs associated with both travel, hotel rooms, food expenditures, and registration at meetings.
Can you comment on how social factors like the availability of childcare will be taken into consideration for the projected June 1 return to work date?
Yeah, let me be clear about that. So when I said June 1, that's the earliest. And we're going to continue to look at careful phase-in. We're going to continue to watch what's taking place in the state of Ohio regarding the curve for COVID-19 and nationally. If we do start anything at June 1st, it will be the next phase-in. It will not be an entire phase-in of this university. There's just no need to do it right now. We're operating by having people work from home, and we are in a slow period. Although education and research continues during the summer months, it is greatly reduced compared to where we will be at the very end of July. So we don't have a huge rush and need to immediately get people back into place. As you're aware, the governor's already got a phased-in approach that will return the majority of the state to a relative state of new normal over the course of the next 2 to 3 weeks. And as we watch that unfold, if we start to see a major change in the COVID curve, that we will not be in place with our operations doing that yet. So we will simply be able to just put things on hold. If, on the other hand, that return has not met with an increased surge and we feel like we're pretty safe with the restrictions around social distancing, mask wearing, and hand hygiene that we put in place, then we will start our phase-in. I'm not telling you it will be June 1. It may be June 7th, it may be June 10th, and it will be in phases, bringing back the next phase of the community before we have everybody returned on campus. At some point, we are going to get back to returning everybody to campus. We have to. Everybody will. I can't tell you whether that's going to happen over the course of a month or 6 months. I just don't know. We're going to have to be careful about how we do it, and we're going to have to be open to how we phase this in slowly, depending on what we're seeing taking place in the community. Your health and your safety is number one.
The white coat ceremony is the next big campus event. Is there a current plan for this?
We've got 2 plans that we're working on. One is that things will be back to a relative state of normalcy and that we'll be able to hold it. The thoughts are this is a low likelihood. And if that's the case, we will have an alternate plan. That alternate plan will be pushed to a later date. And it may mean that we're in a position where with good weather, we do something outside. It may mean that we do something virtually. We just don't know. And I'm leaving this to the college deans to present their plan on how we'll move forward with this. We would like to still move forward with our planned initial date, but we understand that likelihood is becoming less and less as every day passes.
Do you foresee a second surge of the virus?
Well, I'm a surgeon, not an infectious disease expert, so I can tell you I've just been following the literature, both scientific literature as well as the information being shared with us by our government leaders. And the thoughts are that if we look at history, there's a fair chance we could have one. If we look back at things like the Spanish flu of 1918, the initial surge was not the biggest. It was the second surge that came. Many of you may be aware that the director of the CDC believes that We're going to hit a second surge in fall and winter, which will combine both COVID with a surge in influenza. And we don't know what the influenza year is going to look like this year. Is it going to be a bad one? Is it going to be a mild one? And I think that's greatly going to impact overall what the surge looks like. Remember, the intent of all of our measures is about limiting overwhelming our hospital system so that if you do become sick with the virus, either one of those viruses or a combination of the two, you have a place to go get the best possible care for the best possible chance at a safe recovery to normal. That's what we're trying to do. We still believe that the risk of exposure is roughly the same for everybody right now. Between now and the next year, whether we have a vaccine in place, a therapy in place, or we don't, that this virus is going to continue to work its way around the globe, and it's going to continue to put people at risk. We just need to make sure it stays at a very low level so that we have the ability to deal with it.
With the cancellation of the inauguration, will we assume that the July weekend activities be canceled as well?
The July weekend activities are all thought to be on hold at this time.
How will you continue to build employee morale when most of the time we rely on these events to network and interact?
Employee morale is going to be something that we need to spend a great deal of time figuring out how to improve upon. It's hard to do it with Zoom, but we can do it with things like Zoom and other virtual sharing. But it is something that we do have our HR team looking at. We've got to do this individually as small groups as well as large groups. Morale is important. Right now we have less people on campus. And so it's about attending your own morale at home. That really is going to be the most important thing over the short term. Utilizing the resources that have been sent out for how do you maintain your behavioral health and your physical health as individuals. So we will work on that, but I don't have a solution for you right now. We're going to have to, and I apologize, we were scheduled for 45 minutes. I'm currently supposed to be on a call with the other presidents of Northeast Ohio universities to talk about how we can work together to reduce our back-end costs as an organization so that we have more dollars available to run the university as a whole. So forgive me, I'm going to have to close this now, and I will give you an update again on Monday of next week. Thank you.